Hello dear colleagues, today we will briefly discuss about the MRI appearances of the hippocampus. The images used in the presentation are not my own and taken from different online sources such as Radiopedia and Springer's. The hippocampus is a complex structure but important component of the limbic system situated in the temporal lobe. It plays a role in spatial and episodic memory and the reproductive cycle and is involved in the Alzheimer's disease. Hippocampus has taken its name from the seahorse due to its similar appearances, and it is also called Cornu Ammonis due to its similar appearances like Ammon's horn, who is Egyptian god. Let's have a look at the limbic system. This is the cingulate gyrus. This is the corpus callosum. This is the fornix, and this is the hippocampus, which we will discuss in detail. The hippocampus continues by indusium griseum up to the olfactory cortex. Hippocampus continues with the fornix by fimbria, and just below it is the parahippocampal gyrus. Let's have a look at the MRI appearances. This is the axial T2-weighted image. This is the sagittal T1-weighted image, and these are the zoomed images from the coronal T2-weighted images. Hippocampus is broadly divided into three parts: head, body and tail. This is the region of the head, this is the region of the body, and this is the region of the tail. We can memorize it by looking at the midbrain. The structure anterior to the midbrain is head, the structure adjacent to the midbrain is body, and the structure behind the midbrain is tail. This is the sagittal appearance of the hippocampus. Here we can see this is the head, this is the body, and this is the tail. Just anterior to the head there is a structure called amygdala, which is separated from the head by sulcus of the lateral ventricle. This is the zoomed image from the coronal section. This is the region of the head of the hippocampus. The hippocampal head appears like one or two digitations. This is the amygdala. The amygdala is separated from the head by the sulcus of the lateral ventricle, which is called uncal rhesus. This is the temporal horn of the lateral ventricle. This is the parahippocampal gyrus, and this is the collateral sulcus. This image is taken from the midline of the splenium. This is the splenium of the corpus callosum. These two structures are the fornices, crus of the fornices. These are the lateral ventricles, and this is the tail of the hippocampus. The term hippocampal formation is generally used to simplify the concept of the hippocampus and applies to the dentate gyrus, hippocampus proper, and subiculum. The dentate gyrus receive fibers from the entorhinal cortex and have a role in episodic memory formation, while the subiculum is the predominant output source of the hippocampal formation. These are the coronal appearances of the hippocampus. The coronal appearances of the hippocampus are similar to the Swiss roll. This is the area of the dentate gyrus, and this red structure is the hippocampus proper, divided into C1, CA2, CA3 and CA4. CA is actually Cornu Ammonis, as we have already discussed. This is the subiculum, this is the parahippocampal gyrus, this is the collateral sulcus. This is the fimbria of the fornix, and this blue structure is the thin white sheet called alveus. It actually separates the hippocampus from the lateral ventricle, and it continues the hippocampus to the fimbria. This is the region of the temporal horn, and this is choroidal fissure. This is again the simplified diagram of the hippocampal anatomy. Here we can see this is the dentate gyrus, this is the hippocampus proper, this is subiculum, and this is parahippocampal gyrus. Hippocampus is supplied by three arteries. The anterior hippocampal artery gets its supply from the anterior choroidal artery. The middle hippocampal artery gets its supply from the P2 segment of the posterior cerebral artery, and the posterior choroidal artery also gets its supply from the P2 segment of the posterior cerebral artery. So the hippocampus is usually involved in the posterior circulation strokes. During the development, the hippocampus unfolds at its own axis. So the dentate gyrus is the most interior structure of the hippocampus. Sometimes the normal inversion of the hippocampus fails to happen during development and the hippocampus becomes more rounded, vertical and medially positioned than normal, along with deep collateral sulcus. This phenomenon is called incomplete hippocampal inversion. It usually occurs on the left side and may occur on right side as well. It is considered morphological variant by some studies, while few studies show strong association of this entity in epileptic patients. It is associated with congenital brain disorders such as septo-optic dysplasia, agenesis of the corpus callosum. Here we can see the hippocampus is thickened, rounded in appearance and vertically oriented, and this is the normal appearance of the hippocampus, while this is morphological variant called incomplete hippocampal inversion. Thank you.